In contrast to the normal development of T cells in patients deficient in interleukin-2, there is a failure of T cell development in patients with X-linked severe combined immunodeficiency, X-linked SCID, which is caused by a defect in the gamma chain of the interleukin-2 receptor. Thus, this disease showed that the common gamma chain, gamma C, must be important in T cell development for reasons unrelated to interleukin-2 binding or interleukin-2 responses. The demonstration that the interleukin-2 receptor gamma C chain is also part of other cytokine receptors, including the interleukin-7 receptor, helps to explain its role in early T cell development. The gamma chain seems to function in transducing the signal from this group of receptors and interacts with a kinase, JAK3 kinase, which is known to be defective in patients with an autosomally inherited immunodeficiency similar in phenotype to X-linked SCID. As in all serious T cell deficiencies, X-linked SCID patients do not make effective antibody responses to most antigens, although their B cells seem normal. However, as the gene defect is on the X chromosome, one can determine whether the lack of B cell function is solely a consequence of the lack of T cell help by examining X chromosome inactivation in B cells of unaffected carriers. The majority of naive immunoglobulin M positive B cells from female carriers of X-linked SCID have inactivated the defective X chromosomes rather than the normal one, showing that B cell development is affected by, but not wholly dependent on, the common gamma chain. However, mature memory B cells that have switched to isotypes other than immunoglobulin M have inactivated the defective X chromosomes almost without exception. This might reflect the fact that the interleukin-2 receptor gamma chain is also part of the interleukin-4 receptor. Thus, B cells that lack this chain will have defective interleukin-4 receptors and will not proliferate in T cell dependent antibody responses. X-linked SCID is so severe that children who inherit it can survive only in a completely pathogen-free environment unless given antibodies and successfully treated by bone marrow transplantation. Have a great day.